So palliative care, it is a type of care, so the setting can change. People can receive palliative care in a normal hospital ward or in an inpatient palliative care unit, in an aged care home or with visiting services at home. So it's not so much the setting as the type of care. It is a team of medical, nursing and allied health professionals that have special knowledge and skills in managing someone's treatment and care at their end of life. So pain management is obviously a big part of palliative care, as is really looking after the person and their family in a holistic way and making sure that their needs at that very special part of their life are well looked after. I guess it's kind of the person and the family, their emotional needs are very present at that time, and sometimes there are things that some of the health professionals and also things like pastoral care workers can help with as well while you're in palliative care. But the main thing, I think, is that making sure that the environment is set up in a way that actually allows the patient and the family to have as much good time together as possible, and kind of getting out of their way a little bit to do that in a lot of instances as well. So when you move from a busy ward to your own room in palliative care, you suddenly have this time and space to actually have some very important and precious time together, and I think that's one of the really nice things that inpatient palliative care does particularly well. I think it's important to know that if a change of setting is suggested, one of the most important things really is that you make sure that it's a plan into the future. So palliative care will really acknowledge the fact that you are at the end of your life, and sometimes part of that is that you do stop eating and drinking. So we can encourage people to, particularly to drink as much as they can, but to actively intervene to provide nourishment can sometimes be quite stressful and can cause pain and discomfort. It's a tricky task, I think, for families, because I think part of it is to really be well informed and to be present and to be a good advocate for that person, because in any setting things will be difficult and there'll be differences of opinion and things can go wrong. So there's a side of you that will always need to push a little bit, but the other task is really around acceptance and being able to know that sometimes it's not so much about doing as sitting there. So one of the things I always say to people is don't just do something, sit there. The medical team will work with you, and in general you can trust them to provide you with really good advice, but I guess that trust comes from really understanding the advice that they're giving you as well. So yeah.